Okay, welcome again, everybody. This is Group Eight's presentation. Shanti and Tiffany are here as well as our first power couple doing a presentation, Mike and Aaron. So I'll go ahead and turn the time on over to you guys.
Okay, like, so our presentation, we're going to be talking about Medicare and Medicaid, like our teacher just said. So I'm Shanti, Tiffany is there in my glasses, and then we have Eric and Mike. We can have the next slide. So things that we're kind of going to discuss about today, in just different sections, different slides, are just the things that we're going to learn about together. So the first thing is the history of Medicare and Medicaid and kind of how it became, and then the component parts of Medicare, so the federal and state specific issues of the program, and then who Medicare and Medicaid actually benefits. And then the last thing we're going to talk about is the trust funds that go along with Medicare and also the projects that are happening and kind of how they're using that money and how it's kind of going in a downward spiral with how they're managing the money, I guess. Next slide.
Okay, so the history of Medicare and Medicaid developed out of several failed campaigns for national health insurance, beginning in 1915 with President Theodore Roosevelt. Years later, in 1935, healthcare reformers saw an opportunity to make changes after the success of the Social Security program. The idea was to build a national healthcare program with the same eligibility rules, financing, and administration as Social Security. Next slide. In 1962, a national study showed that 47% of elderly families live below the poverty line. Only about half of older Americans had any health insurance coverage at all, and many of those policies had limited benefits. Once retirees left employer-sponsored insurance, they had a hard time obtaining affordable coverage because private insurers saw them as a bad risk. In 1962, the main opponent for national health insurance and Medicare was the American Medical Association, the AMA. The AMA viewed federal insurance and as limiting doctors' profits. Next slide. President Lyndon B. Johnson, on July 30th, 1965, in Independence, Missouri, signed into law the bill that led to Medicare and Medicaid. President Lyndon B. Johnson declared, "No longer will older Americans be denied the healing miracle of modern medicine." Former President Harry S. Truman, the real daddy of Medicare, was issued the very first Medicare money. Medicare was established for people 65 or older. The people that fought for Medicare coverage saw it as the first step towards national health care. The original Medicare program included Part A and Part B, and Part A covered hospitalization costs that was funded via payroll taxes, and Part B covered physician and outpatient services. Its financing coming from beneficiary premiums and general revenues. In 1966, coverage took effect, and today nearly 50 million Americans, 15% of the nation's population, depend on Medicare for their health insurance coverage. Next slide. Medicaid was proposed to cover the poor who were unable to afford health care. The structure of Medicaid was built upon a proposal of the AMA because they feared Medicare would grow into a broader national health insurance program for all Americans. By providing coverage for the poor, it weakened other potential targets of federal health insurance like kiddie care. States are not required to participate in Medicaid, but all have since 1982. The structure for Medicaid is jointly administered and financed by both state and federal governments. Federal government established certain parameters for all states to follow. All states, the District of Columbia, and the U.S. territories have Medicaid programs designed to provide health coverage for low-income people. The state administered their medical programs differently. This kind of resulted in variations of Medicare coverage across the country. At first, Medicaid gave medical insurance to people getting cash assistance, and today it's a much larger group is covered, including low-income families, pregnant women, and people of all ages with disabilities. Next slide. In 1972, Medicare was expanded to cover the disabled, people with end-stage renal disease requiring dialysis and kidney transplants. Medicare in the 1980s, what happened was Congress adopted prospective payment systems for hospitals and physicians. So Washington would no longer pay whatever the providers charged. Instead, they were setting fixed payments in advance. In 1997, for Medicaid, the Children's Health Insurance Program, CHIP, was created to give health insurance and preventative care to nearly 11 million, or 1 in 7 uninsured American children. In 2003, there was Medicare Part C, and it gave private health plans, so if they were approved by Medicare. And in 2006, Medicare Part D was the prescription drug benefit. And in 2010, the Affordable Care Act allowed Medicare and Medicaid to better coordinate for quality services. Next slide.
Okay, so the component parts of Medicare cover specific areas. There's Part A, which is hospital insurance. Part B is outpatient coverage. Part C is Medicare Advantage. Part D is prescription drug coverage. Then there's Medigap, which is Medicare supplement insurance. Part A and Part B are often termed as original Medicare. Next slide. So Medicare Part A is a hospital insurance. It provides for inpatient hospital care and facilities, providing for critical care, inpatient facilities for rehab and hospitals that are providing long-term care, hospice and home health care services, inpatient mental health care in a psychiatric facility, as well as blood if a blood bank is not available. That's Medicare Part A. Medicare Part B is outpatient coverage. It picks up where Medicare Part A kind of leaves off. It provides for many of the outpatient services and products not covered by hospital insurance. It includes preventative medical services, including diagnostic tests and screenings. It also pays the cost of durable medical equipment, such as wheelchairs and things like that. Next slide. Medicare Part C. It's the Medicare Advantage Plus. What that does is it combines Medicare Part A and Part B benefits. It provides for urgent and emergency care services. Private plans cover vision, hearing, health, and wellness programs, as well as dental coverage. Now, Medicare Part D is prescription drug coverage. The prescription drug plan, or PDP, can be a standalone plan, or it can be combined with a Medicare Advantage plan. So that's known as the Medicare Advantage Prescription Drug Plan, or MAPD. Medicare Part A and Part B do not cover outpatient prescriptions. Next slide. So Medigap is a Medicare supplement insurance. Medicare covers a significant portion of an individual's health care expenses, but it does not cover everything. To help offset these additional expenses, many individuals choose to purchase Medicare supplement insurance. Medigap policies, as available in every state, but the policies, they are available in every state, but the policies vary state by state. Medigap insurers must follow strict state and federal laws. Now, there are 10 different plans offered. Prices will vary by carrier, but the plans pretty much remain the same. Next slide. So, state Medicaid issues. The federal government provides funds to help with the rising cost of Medicaid. This program continues to take up a larger and larger portion of each individual state's budgets. Medicaid is the largest category of state spending, accounting for 23.6% of state budget amounts, according to the National Association of State Budget Officers. This amount is likely to continue to increase in the coming years. Medicaid programs are strained for funding, more in times of economic downtimes. When the economy is thriving, there tends to be a decreased need for Medicaid service. But when the economy is suffering, the Medicaid recipients increase. This puts a strain on the funds available to fund these programs. Governors across the country are taking different approaches to manage this. Many states are currently looking into reducing Medicaid expenses through prescription drug coverage. Next slide. Medicare has been labeled as a high-risk program. Due to the complexity, sustainability, and payment issues, and the large size of the program, there have been many management challenges associated with the program. The CMS, which administers Medicare, continues to face major changes in regards to payment processing, managing the program to serve the beneficiaries, as well as safeguarding the program from abuse and fraud. Increase in fraud and improper payments brings up additional issues, that is funding and ensuring that the program remains viable. Next slide. Shantae.
Hey Shantae, let me go ahead and stop you right there. I think you're muted. Let me unmute you real quick. Uh-oh. There you go. Go ahead and start all over.
Okay. Sorry about that.
No problem.
So Mike kind of talked a little bit about the people that benefit from Medicare and Medicaid. So kind of just to expand a little bit more on that. So people over the age of 65, and then usually people with disabilities who are under the age of 65 as well. For Medicare, people that have kidney failure are also beneficiaries of Medicare. And then also something that's called State Children's Health Insurance Program. So what I'm assuming that it is so I know that for people that are in like homes for, like they don't have parents, I can't even think of the word right now, that are like waiting to be adopted, for example, they have Medicare. So people have Medicare through birth all the way up until they're the age of 18. And then for Medicaid, people that benefit from it are the people that are below the poverty line, and that's dependent on every state, which is announced annually, so it's changing pretty commonly. Next slide. Okay, so how are Medicare and Medicaid are funded? So Medicaid is funded by its income tax. Paid on Social Security is one, and then another one is interest collected from investment. But one of the hugest ones is payroll deductions from citizens. So when they first, they figured that they would make a trust fund out of it, so all this money would just collect together, and then they would get a percentage annually to continue to grow. But they weren't expecting to have to use a large sum of that money to help these people. So that's kind of spinning. We don't really have a trust fund since they're not really saving it inside. But Medicaid is funded by the federal government and the state. So the federal government puts a percentage, which can range anywhere from 50 to 82%. It's dependent on the state's income, and then the state will contribute the rest of the money that is needed. Next slide.
Okay, so the Medicare trust funds, according to CMS.gov, in 2015, Medicare covered over 50 million people. The total amount of expenditures were $605.9 billion. The money to fund this program comes from the Medicare trust funds. There are currently 2 Medicare trust funds that are held by the U.S. Treasury. The monies contributed to these funds can only be used for the Medicare. The 2 different trust funds are the Hospital Insurance, or HI Trust Fund, and the Supplementary Medical Insurance, or SMI Trust Fund. Next slide. The Hospital Insurance Trust Fund is funded through payroll taxes pay employers, and those individuals who are self-employed. Funds are also obtained from additional sources, including interest on investments, Medicare Part A premiums, and income taxes paid on Social Security benefits. This particular trust is responsible for payment of the following: Medicare Part A benefits, including inpatient hospital care, nursing facility care, home health and hospice care, and Medicare program administrative costs. Next slide. The SMI Trust Fund funds through authorization by Congress, in addition to money received from those participating in Medicare Part B and Medicare Part D. There is also interest accrued from trust fund investments. This particular trust is responsible for payment of the following: Part B benefits, Part D, and the Medicare program administrative costs. These parts of Medicare are financed through the, like I said, through the program's Supplementary Medical Insurance Trust Fund. It does consist of 2 separate accounts, one for Part B and the other is for Part D. Next slide. So the trust fund projections, there are currently many claims that the nation's Medicare program is nearly bankrupt. These claims are misleading. Medicare continues to face financial challenges, but they are not on the verge of bankruptcy as many believe. Due to the Affordable Care Act, or ACA, the financial stability and longevity of Medicare has been substantially improved. If the Affordable Care Act was removed, the financial outlook for Medicare would worsen the condition of the financial stability of Medicare. So it looks like over the years, obviously the projections have changed, and due to the Affordable Care Act, obviously they've made some changes to the way that it's funded. Throughout the years, they have said anywhere from 2 years to 28 years before it would go bankrupt. So currently, the projection is much better than it used to be. Next slide. So the Hospital Insurance Trust projections, the 2015 report of Medicare's trustees finds that Medicare Hospital Insurance Trust will remain viable and be able to pay for 100% of the cost of coverage provided through 2030. In 2030, the projection is that the coverage amounts will be reduced to 86% and will continually decrease until 2050, at which point it will slowly rise back up to 84% coverage costs. Due to the Affordable Care Act, the HI Trust Fund is now projected to remain viable for 13 years longer than before the ACA. Next slide. The Supplementary Medical Insurance Trust Fund covers Medicare Part B and Medicare Part D. This trust fund will never face bankruptcy and can never fall short of funds. This trust fund always has sufficient financing to cover Part B and Part D costs because the beneficiary premiums and revenue continue and are set at particularly high rates to ensure that they will never go bankrupt. Next slide.
So these are the references that we used in regards to our presentation that you guys can utilize in your research as well to further your understanding of Medicare and Medicaid. And that is our presentation.
All right. You ready for a couple questions?
Sure.
Okay. Well, first of all, I guess the important question. Aaron, how do you think your husband Mike did?
He did great.
Good. Okay. So if you've heard me ask questions in the past, I like to hear things simplified, put into very simple terms that are very understandable, even at a high school, junior high level. So could one of you simply describe the difference between Medicare and Medicaid?
Well, from my understanding, the difference between Medicare and Medicaid is for those at poverty level or below. It's used to give them the opportunity to have health care benefits. Medicaid is for those 65 or older, or those who are disabled. They can qualify at an earlier age.
Very good. Perfect. So I know that there's been a lot of different opinions, or there's a lot of different ideas about Medicare, Medicaid. You talk to specific doctors, and they hate it. You know, you talk to ER physicians, and the majority of their patients are on Medicaid or Medicare, and they don't get quite as much of a reimbursement for it. Through your research, has your opinion of what Medicare or Medicaid does, has that changed? If so, how has it?
I think from my perspective, you always hear people talk about Medicare and Medicaid, and I think that especially with Medicaid, I think there's a negative relationship, I guess, that kind of comes with that people have a perspective that if you're on Medicaid, you're kind of at the lower end of classes, I guess. And as I was researching, I guess I had a new appreciation of what these programs really do and the benefits that they provide.
Anyone else?
Yeah, I would probably say the same thing.
Yeah, I think Medicare is definitely valuable as well.
Okay, great. So two thoughts that I had while going through or while listening to you is, it reminded me when I was first married and we had a kid and I was going through school and I was working and everything. We were actually on Medicaid for a while. Our first kid was born completely on Medicaid, which we loved at the time, and it really helped me develop an appreciation for what Medicaid is really there for, because it was completely, like I said, it's completely subsidized for us. And in any other circumstance, it would have been a huge hit to our income of being able to have a kid while my wife and I were still in school and all those things. The other thing that stood out to me is you don't get a lot of chance and opportunity to hear good things about the Affordable Care Act. I'm glad you guys were able to point out a few things that it's done well. So I appreciate you doing that. Before I let you go, do any of you have anything you'd like to add?
I'd like to say that Aaron did an equally good job, as well as everyone else in the group. Thanks, you guys, for all your contributions on this. I was nervous to do it, and you guys did great.
Yeah, if any of you were nervous, it didn't show. You all did very well. So, good job. You can pat yourself on the back. Maybe you can do another Google Live Hangouts and go have dinner together. All right, well, I'll let you guys go. Thank you again for your hard work on this. You did a really great job. Have a great rest of the weekend.
All right,
thanks.
Thank you.
You're welcome.
Thank you. You too.
Bye-bye.
Oh, sorry. Hey, Tiffany.
Yes?
I'm just going to send you an email real quick in regards to the question you asked.
Okay, great. Thank you so much.
Yeah, you bet. We'll see you guys.
Okay.
Um,
Bye-bye.